Good evening, everyone. I welcome you all for a session on Lean Six Sigma and its application in healthcare. MDAIC Model, a problem-solving and process improvement methodology. Today, for this session, we have an expert speaker from University of Texas, USA, Dr. Seema Prasad. I'm extremely happy and grateful to you, Dr. Seema, for accepting our invitation and putting together this session for us in spite of your busy schedule. On behalf of our management, director, and St. Francis team, I extend a warm welcome to you and all the participants who join us for this webinar and those who are watching us live on YouTube. A healthcare organization is a place where defects and mistakes cannot be tolerated. A simple mistake can cost a human life. Hence, a zero tolerance policy is a must. Ensuring this is a Lean Six Sigma approach that has proven its efficacy in various healthcare environments, especially in dealing with critical patients. To lead a helping hand in improving quality and reducing waste, several healthcare practices and hospitals now make use of Lean Six Sigma tools. They do so to achieve the highest level of efficacy in patient care. When Lean Six Sigma is used in healthcare, it has the power to eliminate any and every variation and defects in processes. It also has the ability to streamline all procedures by making them efficient and less costly. This paves the way for improved care of the patients. In any hospital or healthcare practice, a defect is something that always leads to the dissatisfaction of patients. Such defects may include a long waiting time to consult a doctor, incorrect diagnosis of an ailment, incorrect treatment of the same. All these defects are frustrating as well as quite serious. Hence, must be removed as soon as possible to make life easier for the patients. The possibility of variance is much higher in the patient care industry than in any other process because it is a hands-on process. The variables are quite small in size, hence cannot be quantified properly. But with the data-driven approach of Six Sigma, the improvements can actually be measured by analytics and business experts. The DMAIC problem-solving method, which involves 5 main steps: define, measure, analyze, improve, and control. This cuts out a clear roadmap for improvements that need to be implemented in the system. The entire topic is very interesting and the need of the hour. Now, I request Ms. Linia Joseph, Associate Professor and Moderator of this session, to continue with the session. Over to you, Linia.
Thank you, ma'am. Being moderator of today's session, I take the opportunity to introduce today's presenter, Dr. Seema Prasad, MD, MPH, University of Texas, SPH, MDA Cancer Center, Houston, Texas. Madam is having an immense educational background of achieving MD from Rajiv Gandhi University of Health Sciences, Bangalore, India. MPH from University of Texas Health Science Center, Houston, USA, and Healthcare Management Certification from Houston, USA, along with certifications as Clinical Research Professional by Society of Clinical Research Associates, ECFMG certified from USA, along with ACLS certification by American Heart Association. Madam has also gained professional affiliation from Society of Clinical Research Associates since 2012 and American College of Healthcare Executives since 2016. There is an extensive work experience in different areas of clinical medicine, pharmaceutical drug industry in managing and regulating multiple clinical trials, study data monitoring, and analysis for purpose of scientific publications. At present, Madam is a CME trainer in human subject research, clinical outcome safety, and healthcare management related topics. To add variety, Madam has done various presentations and publications and is currently working on projects like REBOA and sepsis study. If participants have any questions, kindly type them into the question box in your Zoom control panel. It will be put forward at the end of the webinar. Now, without further ado, I would request our speaker to enlighten us with her words. Over to you, ma'am.
Thank you, Dr. Blessy, and thank you, Prerna. Is that the right way I'm pronouncing your names? Yeah, it was a great introduction. It was nice to hear that you have done so much of background, gathered so much of background information. So thanks for introducing me to the big group. I miss seeing each and every one of you. As we know, the virtual is the new norm. I generally like interactive sessions where I have people sitting in front of me and I can stop and answer their questions, or I can question them. That's what I like. But we can still do that as much as our time permits, and how we can make this go smoothly. I'm happy if you have any questions while I'm talking. If you do not understand something, you can make a note of it, ask me to clarify later or at the same time. I'm okay with it. I have two screens in front of me, so sometimes you might see that I'm not looking at you, but then I'm definitely probably looking at something related to the presentation. I have to stop my alarm, sorry. Okay, so let's get started. As Dr. Blessy has given a very nice introduction to the topic, Lean Six Sigma and its application in healthcare. Just for today's presentation, I will focus on the MDAIC model, which is a problem solving and a process improvement method, which is not only used in business management, hospital management, it can be introduced in every aspect of your life. Wherever you have issues and you're facing things are not flowing the way you want, this particular model can be introduced. Let's go ahead and look at the slide 1, where I'm looking at Lean Six Sigma problem solving method and some of the statistical tools. Today in this presentation, you're going to see how you discover the process of collecting and analyzing data to some extent. It's a very deep topic, so we probably might need more presentations on that, but I'm going to touch that. How to assess Lean and Six Sigma implications in your daily work. How to improve the profit, basically by reducing inefficiencies and reducing the waste. And how to introduce the MDAIC method in the project you're working on. How to have a maximum production by using few resources, and how to lead and coach quality improvement initiatives. So as you see the proverb here, when you face a problem, it is probably too late to start putting corrective measures. So the practice a philosophy of continuous improvement, where you do a little bit of change every day so that you're ready when actually the crisis happens. So what do you mean by lean? Lean basically means to use less and do more. So you think less, and you use less resources and try to give maximum productivity. That is what lean means. So a combination of Lean and Six Sigma. Six Sigma is something which focuses on preventing defects and problems in any kind of project. And Lean basically focuses on waste reduction. So a combination of this is generally termed as Lean Six Sigma methodology. So the Lean Six Sigma together is going to strengthen your system by problem solving and improving the process and get maximum results. So in this particular diagram, you see how the continuous quality improvement is a joint efforts or multi-process improvement, the lean process, the Six Sigma, and quality improvement. They go hand in hand. it is a systematic approach to improving quality in your business or your healthcare facility. Here, I have kind of put down the different parts of DMAIC. As you see, the mnemonic stands for define, measure, analyze, improve, and control. So basically, this model is a roadmap which is going to help you improve your system and bring much more quality in your results. So the define basically is defining a problem. So first phase is identify what the problem is, and which is followed by setting up certain objectives. And after, you have to make sure you find out what you need to improve, basically. Okay, that is the measure phase. And you have to determine whether that particular thing can be measured, whether it is measurable. For example, there is, increased expenditure in the outpatient. So it is measurable in terms of revenue spent. So that is what I mean when I say, can it be measured? The analyze phase basically is to analyze the process where all the data that you have collected is put together. You have a look at it and finally find out what is the problem. You define the factors that are influencing your problem. Coming to the improve phase, which basically involves identifying and setting improvement plans. Okay. And the final stage is going to be the control phase, where you have already set the improved processes. You're just trying to make sure that the future processes are working properly. And you have done the changes you wanted to do. So you're showing that the improvement is happening and it will sustain. So here I have the DMAIC framework just spread down in the form of a table. It's the same steps on the left-hand corner. All I'm trying to tell here are the different tools that you used. So the right-hand corner tells you the tools that you use for every phase. For example, define, where you define a problem, you use brainstorming sessions, like you call for a meeting. You have everybody, you have the nursing students, you have your manager, you have the administration, everybody sits together, puts their views about the issue, and then you just gather the information. So you have a brainstorming session. The VOC is a voice of customer. So depending on what issue you have, for example, the patients are complaining that you're charging too much for a particular drug. So in that case, you need to see the voice of customer. What is exactly the complaint or issue? We have certain things called affinity diagrams and project charters. These are not complicated tools. They're very simple computer tools where you just put down your objectives, goals, and it helps you direct in the right direction. So as I said, for this presentation, I'm not going to focus too much on that. Coming to the measure, we use certain tools like simple checklist or histograms, or we use scatter diagrams and Pareto graphs. These are the common things we use to put all the measures together. Similarly, for the analyze phase, we have, we generally most commonly use the cause and effect diagrams and the Pareto diagrams. So we see everything visually. I'll give you some examples as I go further in the slides so that you can have a better understanding. Coming to the improve phase, the tools used are flowcharts, histograms, scatter diagrams, Pareto graphs. These are commonly common things which we learn in college and I think higher secondary school. Kids are generally introduced to this part of mathematics, and nowadays computers have app installed as well. So as long as you have a data, it can run the results for you. And finally is the control phase, when you have, you put all you summarize your results together. So going to the next slide. So where do we begin? We have an issue. Where do we actually begin? It's a little complicated, confusing path, right? So what you need to do first is identify the problem first. So we come up with the problem statement where we define what the issue is. We'll just look at a problem statement on the next slide. Once you have the problem identified, the next step would be the management should create a team, a group of teams from the hospital who's going to basically work on the problem. After that, you might create a project charter, which is nothing but a document which lists down your goals, whatever you need to collect the data, the time frame in which you're going to collect the data and bring the changes. You need to have a time frame. that you need to finish your project in 6 months or 6 weeks. You need to define it. And then you have the find the voice of customer, like, are you going to do surveys? Are you going to do telephone calls to, find out what the problems are exactly? And it is important to have a team for a vision for the team, so that, you don't get lost while you're working on the project. All right, so what are the elements of a problem statement? Problem statement is nothing but a cluster of sentences which defines your problem. So it should have three important parts. It should have your time period defined. You should have the issue properly explained. It should have the metrics that you're going to use. So what do I mean by the time period? Do not use words like currently there is an issue in the hospital. Avoid using that. For example, you be very specific when you want to report something, that this particular issue, there were increased rate of sepsis in the ICU from May 2007 to September 2007. So you're very clear about your time period, okay? So next is identifying the problem. So the problem, what is the defect, what is the opportunity, or why do we need to do the project should be clarified. For example, the expenses in the medical ward was increased in the last 1 month because of COVID crisis, or it could be a non-compliance issue with the hospital staff, or it could be dissatisfied. You had an increased number of dissatisfied customers in the past 6 months. So these are the issues which you need to, these are just examples which you want to address. The third thing is metrics, is how are you going to know how big that issue is, right? So if you're going to say you had increased number of dissatisfied customers like the beginning of this year, the first 6 months, you need to show the percentage. We had 50% of patients who were not happy on their surveys once they were discharged from the hospital. So that is a metrics. You're giving a number and to show how big the problem is, right? So at the same time, you need to have something like baseline. For example, in 2019, you had a very good review in your hospital. By December, you had a very good review that the patients were discharged from the hospital and they were very happy. That is your baseline data. Whereas this year, from January to say July, the satisfaction rate has come down. So those are your metrics which you're going to compare and show that there has been a fall in standards which we are trying to improve. So here you see, I just gave you an example of a problem statement. I'm trying to, these are not real numbers. So let's read it out. This is just an example, which is very apt for our hospitals. So from December 2012 to 2013, emergency room patients admitted to the hospital spent a total average time of 7.3 hours in the ER, that is the emergency room. 92% of those admitted did not meet the system goal of 4 hours. The long ER wait times create delay in a patient receiving appropriate care and increases our LWBC BS percentage, that is left without being seen, that's a mnemonic. By reducing our length stay by 30%, we would increase the in the ER that would equate to approximately $2.5 million in revenue. So what you see in this problem statement is you have the time defined very clearly, you have the metrics, you have a baseline number. The average stay wait period was 4 hours, which kind of increased to 7.3. So that's the metrics. And the expectation, what is your expectation? And what do you want to change? So everything is listed here. And then you can see how serious the problem was and what effect it was causing on the smooth running of the ER department. So this is a problem statement example, which has all the parts listed. Coming to goals, you need to get smart with specifying your goals. That means you need to address who it is for, what it is for, when and why. So just make sure you have these components in your goals. It is very small and component. It is not a huge goal that you don't know what you're doing. You just need to address these particular aspects and you should have a very good goal. Where you define, you have the names of the resources involved. Like it was the ER in our problem statement, the resources are involved. And then you specify what you want to accomplish. Like in the problem statement, we wanted to reduce the wait time, right? you have a time frame determined in that. So you're saying that you wanted to reduce the wait time by 30% and then increase the revenue for the hospital. So that is the goal. Is there something that anybody sees that is missing in the problem statement? So I'll just go ahead and answer that, because what is missing is you don't have a time frame there. You need to say that I'm going to address this issue in the next 6 months. So you need to define a time frame for your goals to be accomplished. So that needs to be set as well. So this is an example that I just came up so that you have a better understanding of what I talk in the next slides. Just keeping in mind the current COVID situation, I thought this was something which is happening in every nursing hospital and nursing school and every outpatient clinic and most of the hospitals in India as well. As the COVID started, we had increased load of patients with symptoms, right? Anybody who had a common cold or fever was just lining up in the clinic. So let's just read through this problem statement and see what you get out of it. For example, in your nursing college, you had an increased load of outpatient turnover during the COVID pandemic, which happened from March to July 2020, and say that the increase was by 20% from the baseline. Okay, so the long wait time in the OPD has increased from an average of 1 hour to 2.5 hours, which affects the timely care of patients. So by reducing the patient turnover in the OPD by 50% and directing the COVID suspected patients to the COVID clinic in the next 30 days will help reduce staff allocation and increase revenue generation. So this is a problem you're encountering in your outpatient clinic, and you want to fix this problem. So it is a very simple problem that I came up with so that every nursing student can understand. So here the problem is there was an increased turnover and suddenly you had such a big group of patients and you did not know how to manage. And with the COVID pandemic, there was a staff shortage. You did not have any staff in the OPD. Many doctors were not coming to work. You had to manage the staff, and then you did not have enough resources in terms of medicines to treat, or you do not have enough space. So that is your problem and you want to fix it. So let's see how you'll go about this. So as you know, the define phase is the first phase where you're going to define your goals in this case. Okay, there's something called as the SIPOC diagram, which I'm going to show you in the next slide. It's the SIPOC diagram again, which means suppliers, input, process, output, and customers. It basically is a chart which helps you to define your goals and manage your patient flow efficiently. So what are the things which you need to include in your goal for this particular problem? I just listed down some of them that came to my mind. First thing is you have to manage patient flow efficiently. You need to use your resources efficiently. You need to address your staff shortage, as I already mentioned, because many staff were scared that they're going to contract the COVID. So, there was a shortage. I'm not only talking about nursing staff and the medical staff, I'm also talking about the mid-levels, and I'm also talking about the other helpers, which are generally, there to transport patients and everything. There's another problem you need to address is people management, process improvement, and the burden that is going to fall on the nursing staff to manage this big group of patients which are there in the OPD. So this is the SIPOC diagram, which I said, as you see, it's a simple table where you have columns with suppliers, input, process, output, and the customers. So this little chart just helps you brainstorm and put all your information together so that you can work on your project. So as you see, what are the suppliers? What do I mean by suppliers? The suppliers are nothing but the institution, the hospital, or the nursing school, which is supplying the resources. Coming to the input is nothing but the people involved in carrying out the daily process. So in this case, you have doctors who are treating the patient. You have excuse me, medical interns who are also there, or you might have the nursing supervisor who is going to take care of the nursing staff. You have nursing intern students, you have nursing students, you have helpers, and you have pharmacists. So these are some of them which came to my mind, and it doesn't mean that you don't have other people, but these are the primary people involved. So let's look at the process. What do I mean by process? Is what are the processes that these resources help us complete? Obviously, the doctors help us completing patient consults. Um, the medical interns and the nursing interns are helping screening the patient, right? You know, doing physicals on the patient or doing vitals on the patient. The helpers are helping us triage the patient, like moving the patient from the OPD to the wards or to the operation room, depending on the condition. The pharmacist is prescribing medication. So what is the output that you're looking at? Basically, you're completing your patient treatment and you're completing patient admission if necessary. Coming to the customers who are involved, primarily our stakeholders are patients. Apart from that, we have other stakeholders, which could be the hospital administration department, which are getting affected as well. So what you see is this particular chart has put down all your components together. Once you have everything put down, you go to the next phase, which is the phase of measure. Excuse me. So the first question that you're going to answer to yourself is, can the problem be measured? So in our problem statement, yes, the problem is measurable. We are looking at the increased load of patients in the OPD, right? So we can measure this problem, yes. What you need to do is record the time at the following stages. From the patient arrival to the doctor visit completion, you're going to record the time for the complete doctor visit to be completed, the time the doctor is really taking to examine and finish, and the patient is walking out of the door, the time which is taking for screening tests, the time taken for patient triage. And once you have this time listed down, you have to validate the data. And validate the data means make sure that you're recording in the same pattern and the same units, and so that when you have all data together, you can just compile it into one. And make sure, decide the methodology that you're going to use. Are you going to use a paper and pen, or do you have tablets? Are you going to use electronic instruments? So make sure you're validating the data you're collecting. And this is important as much as it sounds very simple, because you need to show that this problem is really happening so you can fix it. The next phase is the analyze phase. So basically it is to identify the root cause of the problem in this phase. Why is the issue really happening? We commonly use the Pareto diagrams and the root cause analysis method. Now, what are these methods? I'm going to show you a few examples of how it looks. It's not complicated at all. Like how you see, this is a very general diagram I'm showing you. It's a Pareto diagram, which somebody made through the human history, where they were trying to see what were the problems the prehistoric people were facing when they were cooking with fire. Okay, it can be used for any problem. So as you see, many people reported that the problem they were facing was that their body or the beard was catching fire. Okay, you see the first graph, which is like almost equivalent to 40% of the problem, followed by they had difficulty lighting the fire. Then they had problems, complaints that they could not work in the rain. When it was raining, they could not cook. Then you have the problem of burning their own hands. Some people complained that there was too much of ash getting into their eye. Many people said that they could not cook a particular, recipe on it. And as you see, what you see in this particular chart is you put down all the problems that are become reported. And it is a visual data. The moment you look at it, I think even fifth grader or a 10th grader can tell you, okay, the maximum number of people had problems because their beard was catching fire. So it's very visual data where you immediately catch the problem and you know what needs to be addressed. Okay. Another example of Pareto diagram is here. Now, in this case, I'm trying to tell you what were the types of medical excellence commission. So they tried seeing what were the different types of medical errors that were happening in the hospital. So it is like what you see first. The first thing that strikes to me is the first longest doses that were missed. So maximum number of medical errors were happening because missed doses. As you see, 92% of cases were because of that, followed by the wrong time in which they were being administered. And the third major cause was the wrong dose, followed by a fifth one, which was a wrong patient being the cause. So as you see here, you put down all your problems that were happening, leading to medication errors in the hospital. And you're also seeing which problem is more severe versus which problem is less severe. So as you see, the vital few on the top, you have the first 4 categories, which are causing the maximum number of errors, is the one which needs to be addressed, maximum. Followed by the trivial many, which are many patients, but then they are very minor problems, which you can address after you have addressed the major problem. So this is a Pareto diagram, which puts the data in front of you and makes it very easy for you to proceed. Okay. So the other thing I mentioned was the root cause analysis. As you see, what you see to your what appears to your eye as just the symptoms. So when you dig further, you're going to see the real cause for the problem. So this is what basically it means. You need to dig further to find out the root cause. There is a very simple chart which we use, which is called 5 whys. So once you've defined your problem on the top, like we have already defined a problem, you have to start answering these 5 whys. So what we had a problem of increased turnover of patients in the OPD has increased. So you just have to answer whys. Why is this happening? So you would say, yes, because there is COVID crisis going on. Then you ask you, why is that happening? Because COVID is a pandemic and people are not practicing social distancing, so it is spreading very fast. Why is that happening? Because people are not wearing masks. Why is that happening? Because people are not educated. Why is that happening? Because people are not watching the news, or the medical professionals are not educating them. So as you see, if you answer your 5 whys, it will trickle down to the basic problem. And if you're not able to answer your last why, you have to just go back and do a little more brainstorming. So you can list down the major problems. Okay, so this is the root cause analysis, which I just put it, it is a very, what do you say, my method, my way of putting it down to the problem statement I just came up with. As I said, you have your OPD having a lot of patients. So this is the root cause analysis. This is how it will look like. So what you do in this case, you have to list down the processes. So as you see, the first thing which I listed is patient arrival. The people who is involved as a helper, who kind of makes the patient sit down. This is, I don't know how it actually happens in your nursing home, but then from the time I was practicing in Bangalore, probably is the same. So the time patients are consuming is around 10 minutes. Patient waiting period is around 15 to 20 minutes. Patient screening questionnaire is taking around 10 minutes. Patient screening by the nursing staff, that is, medical screening, is taking around 15 minutes. Lab screening for suspected patient, that is, if a patient has flu symptoms, you're immediately taking them for a nasal swab or something, that is taking 30 minutes. Finally, after all this, the patient is okay, doesn't have COVID symptoms, you are finally triaging that patient to the doctor, and the doctor spends around 30 minutes to really consult the patient. Finally, the doctor finds that the patient needs to be admitted for further testing. Then the patient is moved to the wards, that is patient triage. That takes a minimum of 30 minutes. So what you see here is the overall time, average time that the one patient was spending in the outpatient was around like 2.15 hours here. Rather than an hour or an hour and a half that the patient should come in and just leave the OPD, but the patient was lingering around for a longer time, right? So that is what was causing the increased turnover. So what are you going to do after you have the root cause analysis completed? You're going to move to the improve phase. You're going to come up with steps for improvement. So as we are learning about Lean Six Sigma, you're going to practice lean processes. Some of the points are listed here, which are not all the process improvement plans which you'll do in this situation, but the main ones are going to be, we are going to decide that no patient attendant is going to be allowed with the patient if the patient is not critical or less than 18 years. So what do you do here? You're reducing the crowd, you're reducing the number of people coming into the facility, right? You're going to cut cost by avoiding duplication of work. So as you saw in the root cause analysis, patient screening were done by multiple people, right? So you just cut down that work, just limit it to patients are going to complete a questionnaire right at the hospital entry, for example. So what will happen once you finish the questionnaire at the hospital entry, you're able to divert the COVID positive patients or patient with positive flu symptoms directly to the COVID clinic rather than sending them to the outpatient. So this way you're allocating resources more efficiently. You're going to reduce the staff requirement as well. Um, and then you're going to do some resource management by optimizing space, and then you're going to manage your beds and operation room usage more sufficiently. For example, if you have enough space in your wards, fine, but if not, I think the management has to decide and open for example, if you have an auditorium, convert it into a place where you're going to keep your COVID patients, put down 100 beds, some kind of system like that. If you think the bed number is the shortage. Coming to your operation room usage, you can come up with something like where you're going to do only elective operations. Elective operations are not going to be done, only emergency operations are going to be done, something like that, so that you're going to reduce you're going to do resource management in a better way. You're going to encourage volunteers and students at this point of time, because hospital management has also needs to manage the funding as well. So, and another thing is, whatever you decide, it needs to be practiced across the organization. The entire organization needs to follow the rules. As I mentioned, people management, there are a few points I need to emphasize on. First thing is, you're going to start by appointing monitors. The monitors are going to be people with good interpersonal skills, a good communication skill, who are good at decision making, who can delegate jobs, who have a very good problem solving attitude. Coming to the staffing needs, you're going to address the shortage of staff, and at the same time make sure performance evaluation is done. The third thing you're going to do is identify potential leaders, and this has to be done all the time, identifying potential leaders and give them training opportunities to just enhance their performance. I know this cannot be done in a situation of crisis like COVID, but if this is done on a regular basis, you can have a team ready for crisis situations like this. At the same time, allow for feedbacks. Okay, give your employees opportunity to improve and also address performance issue when an employee is not meeting expectation. And if there is an issue that has brought you attention, fix it right away. Don't leave it for future, because patient safety is important, and you cannot take a chance with it. So any issue that has got your attention needs to be fixed right away, whether it is a small problem or a big issue. Only thing you're going to do is you're going to prevent a smaller issue from growing into a bigger one. Okay, so in our control phase, what we will do is once we have come up with the improvement plans, as I mentioned a few of them already, we have to make sure that it is implemented properly, and you have to make sure the performance is measured and monitored. So once, for example, as I said, the patients are going to be screened at the doorway or at the gate itself, and you're going to divert the COVID positive or the flu positive patients to the COVID clinic directly, right? So after that, the patients with other medical problems will go to the outpatient. There has to be some persons recording the data and seeing if your process improvement plan is working, whether the wait time of these patients have reduced or not. You have to see if it is working or not. Nursing supervisors need to supervise changes, or either on a weekly basis or a bi-weekly basis, because you need to make sure that the labor has reduced, the quality has increased, and the waste has also come down. The wastage of using multiple screeners, as I mentioned, for screening, just use a nursing student, or don't use a nursing student, don't use a nursing intern and a medical intern as well. There are too many people involved there. So you try to cut down your resources, and make sure the data that you're recording is implementing changes in terms of the time that is spent in the clinic, the travel time that is taking. Make sure you record the data to show that the changes are working. Manage the availability of patients in the ICU beds and staff distribution as well. Control the budget, which is more important for the hospital administration. Make sure the inventory that is being used is reduced. In this COVID crisis situation, I think the whole world was dealing with a shortage of PPUs and masks. So it was a very unhealthy situation. So it is very important when you're doing these kind of quality measures, you pay attention on reducing the involvement usage of inventory. At the same time, make sure that your improvement plans are reducing the space used, which is very important. It is a very minor thing, sounds very simple, but space reduction, if you is very important for hospital management. I know they can understand. If you can, have a 10 beds in a room compared to 15 beds, you are actually losing on revenue. You know that you're losing on the patient revenue at that point of time. So space management is very important. Okay, so thinking lean tips. How do you make sure that you're thinking lean on an everyday basis, not only in a situation where you identify your problem, you're thinking lean on a daily basis. It's very important to do that. So lean thinking basically begins with driving out waste so that all workers add value and serve the customer's need. So if you have an attitude where on your daily basis, the nursing supervisor is doing her daily rounds in the ICU, just keeps an eye that you're reducing the daily waste, like the usage of resources in the ICU. I know most of us, you don't know how much of syringes are used on a daily basis. I've seen it on my in my experience. So I'm talking about the wastage of material, the wastage of manpower, any kind of wastage. So try to reduce the wastage, and then at the same time make sure your customers' needs are being completed. The customers in this case are patients, so you have to do everything that keeps the patient's needs in mind. Keep them happy, keep them safe. That's it. And the commitment to lean must start. Where does this start? It has to start from the top of the organization. As I said, you need to form a team. There has to be a leader who's going to introduce this system into the whole organization. And together, it is a teamwork, basically. It is not a one individual work, it is a teamwork. So there's some case studies which I wanted to talk about of quality improvement. There are lots of case studies which you can search up on the net. Two of them which I want to talk about is the first one is a case study that was done which to decrease the anaphylaxis rate due to subcutaneous immunotherapy. It was a patient safety alert system. So what happened here was, in this study, there was an increased rate of reactions from immunotherapy. So they studied the impact of quality improvement measures on these side effects. It was a 2-year follow-up which they did. They collected data using Pareto diagrams, root cause analysis, and everything. So and then saw if this was helping them reduce the rates. So what they did was, in this particular hospital in this study, from 2008 to 2012, they reported around 9 episodes of anaphylaxis. So now anaphylaxis is a common reaction which we see in cancer patients receiving immunotherapy. So people who are allergic to it kind of develop reactions in the form of fever or hives or a rash. It could be anything, and the severity is also again different. Some of them have a very severe grade of reaction, and they need immediate Benadryl injections, or they sometimes need steroid injections to subside the reaction. So it is a very life-threatening situation if it is not addressed immediately. So this is a very serious symptom, which serious problem that we face if not addressed. So that is why I call it as a patient safety alert system. So when they did this particular study, they found that out of those 9 patients, 2 patients were dosing errors. So the dose was not given accurately. One was a compounding error. There was a problem with mixing the dose properly. And then the 2 patients had allergies to the drug. So now in this case, they did a quality measurement, introduced quality improvement measures, and they did it for over a process of 2 years, and they had good results. So they saw that implementation of quality measures, including vial verification before injecting the drug, vial testing, just these simple methods brought us improved the safety and decreased anaphylaxis rate in this particular institution. So this is an example of Six Sigma methodology again, as you see. The second study that I have mentioned there is about improving the flu vaccination rate among healthcare workers. So, as you know, healthcare workers need to be immunized against flu every year, basically primarily for the reason that they don't transmit the infection to the patients. They have to stay healthy themselves. But in Texas, in the healthcare system, it was found that in spite of educating patients and providing the flu vaccines to them, the rate of flu vaccination receivers was not was kind of 50%. So they did this study and they implemented quality improvement plans on improving the percentage of patients receiving, healthcare workers receiving the flu vaccine. So they used Pareto diagrams, they used root cause analysis again, and they saw positive results. So they were able to improve the rate of healthcare workers receiving the flu vaccine over years. So this is another example of a positive quality improvement tool which resulted in positive results. So I think I'm done with what I had to present today, and I'm ready to take the questions.
Thank you, Dr. Seema, for this insightful and wonderful session. The session covered many important aspects of the subjects and most importantly created the need for Lean Six Sigma in healthcare. With the use of Six Sigma, it becomes a whole lot easier for patients to access information on healthcare providers in a much easier way. The higher the quality of the patient care, the more will be healthcare providers be chosen. You have very nicely covered all the entire topic with SMART goals. What are the elements of a problem statement? You have emphasized on the SIPOC diagram. You have added so many examples which have broadened the insight of the audience. Root cause analysis, 5 whys, they were excellent, and I think they have created a brainstorming among the participants. So I'm sure all participants enjoyed the presentation and will take away important lessons of DMAIC problem solving method and Six Sigma methodology and tools. I'm sure there might be some questions by the participants. I request Linia to put forward the same and propose the vote of thanks also. Over to you, Linia.
Thank you, ma'am. We are now going to answer questions asked by the participants. So first question asked by Sonal Netram is, what is the difference between the Six Sigma, DMAIC and DMADV methodologies?
So let me see if I got the question correctly. What is the difference between Six Sigma, DMAIC methodology?
And DMADV methodology.
DMADME.
DV.
So here the only difference is the last step. The V stands for verification, I think. As I can tell you, there are different abbreviations used by, in quality improvement, there are lots of abbreviations. So it is very similar to it. But once you have let me put that slide. You verify whether your improvement phases are working. Once you have a plan for your improvement phase and you implement those plans, we are followed by the control phase, right? But in case your improvement phase is not working, you go back and find out the root cause again. So you're verifying whether your improvement phase is working or not. So if your improvement is not working and the control is not giving you positive results, you will go back to your measure and analyze phase to verify what you have decided to implement is correct or what is the problem that is happening there.
Ma'am, there is one more question. Is the Six Sigma healthcare certification course?
There are certification courses that are available in US. I am not really sure of what kind of certification courses are available in India. I'm sure they are. Yes, there is a certification course just in Six Sigma, which is very compact and kind of talks about what I just spoke in a little bit of more detail, where they're going to talk about the tools which I mentioned, the project charter in a little bit of more details. They're going to talk about other tools where you have the fishtail diagram and all that. So there are certification programs for 6 months as well here. Generally, they advise people to be a part of a project. While they're working on a project, a problem project, they learn the Six Sigma. So they will actively be involved in a project where they're going to go, they'll be given a problem statement. They're going to really go into that particular field. They'll go to that particular hospital or clinic, and they're going to find out, they're going to do all the processes that I really mentioned here in brief. So they will be walking through a real life project and learning the Six Sigma methodology. And at the end of the course, they will be getting a certificate. Yes.
Thank you, ma'am. That's all with the questions. So on behalf of St. Francis College of Nursing, I want to offer thanks to our honored speaker who acknowledged our invitation and gave her valuable insights on Lean Six Sigma and its application in healthcare. I am sure your address will help the participants a lot. I also take the opportunity to thank Father Lucas, Director, Professor Dr. Blessy Anthony, and all faculties for their immense support and encouragement. I also would like to thank all the principals and faculties of different nursing colleges for motivating their students to be a part of today's webinar, and also nurse managers and the nursing staffs of different hospitals. Once again, thank you everyone. We appreciate your presence for joining us today. I would request all the participants to kindly fill the feedback form that is being shared in the link in the chat box. Thank you once again.
Thank you. Thank you, Dr. Blessy and the rest of the faculty for giving me an opportunity. It was a great time.
Thank you.
Thank
you, Dr. Seema. Thank you, everyone. Thank you, everyone.
Participants, you are requested to kindly fill the feedback form. The link is being shared to you in the chat box. Thank you once again.